How to choose between rocuronium and succinylcholine. What's up, you guys? It's your ER pharmacist. This is part 6 of our RSI series where we're understanding RSI meds rather than memorizing them. Today we're talking about choosing your paralytic. So we're mostly concerned about rocuronium and succinylcholine when we're choosing between paralytics for an RSI. There's a couple factors that we have to think about. So it's not necessarily picking the correct RSI med. It's more so thinking about our situation and our patient. The difference between succinylcholine and rocuronium is going to come down to onset of action, duration, and then different contraindications. So succinylcholine, fast on, fast off. So it's great for patients who maybe are a more difficult airway, or you know that they're not going to be bucking the vent. They don't need necessarily a deep sedation. We can give them this quick on, quick off paralytic, and then just start up our sedation at a low rate after the fact. Or if you're going to need to do some sort of neuro exam, this is really great because your paralytic will wear off quickly. And it's one of my favorites because we know that someone's not paralyzed without being sedated, right? We know that that paralytic has worn off. We can just start our sedation and know exactly where they're at with that. So that's super helpful in my book. But otherwise, succinylcholine is a great option. Rocuronium, on the other hand, has a slightly slower onset of action, so not ideal, but it does have a longer duration of action. In a lot of ways, this is problematic because, like I was saying before, we're not going to know where someone's at with their sedation because they're paralyzed. So you really need to commit to that post-intubation sedation and get that on board right away, because someone might be paralyzed for up to an hour with rocuronium and they may not know, you may not know if they're sedated. So you kind of have to start that sedation off at a really high rate. Rocuronium can be helpful for someone who you think is going to need that deeper rate of sedation and potentially paralysis for vent compliance. So choosing between succinylcholine and rocuronium, it's not necessarily about picking the right drug, but it is about picking the right drug for your patient and the clinical situation. Follow along as we talk about RSI meds, and go back and watch part 1, 2, 3, 4, 5, 6 to learn about RSI meds, understanding them rather than memorizing them. That's what I got for you guys. Bye!